Nutrition Science, the Health Risks of Being Underweight. The 2015-2016 National Health and Nutrition Examination survey estimated that 1.5% of adults and 3% of children and adolescents in the U.S. are underweight. Underweight individuals represent a small portion of Americans, yet the health risks associated with being underweight are an important part of the discussion on nutrition and health. Being underweight is linked to nutritional deficiencies, especially iron deficiency anemia, and to other problems such as delayed wound healing, hormonal abnormalities, increased susceptibility to infection, and increased risk of some chronic diseases such as osteoporosis. In children, being underweight can stunt growth. The most common underlying cause of underweight in America is inadequate nutrition. Other causes are wasting diseases such as cancer, multiple sclerosis, tuberculosis, and eating disorders. People with wasting diseases are encouraged to seek nutritional counseling, as a healthy diet greatly affects survival and improves responses to disease treatments. Eating disorders. The National Institute of Mental Health defines eating disorders as serious and sometimes fatal illnesses that cause severe disturbances to a person's eating behaviors. People with eating disorders often experience a preoccupation with food choices and body weight, and they frequently have a distorted body image, believing that self-worth is tied to body size and shape. Eating disorders that result in underweight affect about 8 million Americans, and eating disorders have the second highest mortality rate of mental illnesses, outranked only by opioid addiction. Prevention and proper treatment of eating disorders must involve a multifaceted approach, including physical, emotional, and social issues related to each individual's needs. Anorexia nervosa. Anorexia nervosa, more often referred to as anorexia, is a psychiatric illness in which a person obsesses about their weight and about the food that they eat. Anorexia results in extreme nutrient inadequacy and eventually organ malfunction. Anorexia is relatively rare. The NIMH reports that 0.9% of females and 0.3% of males will have anorexia at some point in their lifetime. But it has an extreme example of how an unbalanced diet can affect health. Anorexia frequently manifests during adolescence, although it may emerge much later in adulthood as well. People with anorexia consume on average fewer than 1,000 calories per day and exercise excessively. They are in tremendous caloric imbalance. Moreover, some may participate in binge eating, self-induced vomiting, and purging with laxatives or enemas. The exact causes of anorexia are not completely known, but many things contribute to its development, including economic status, as it is most prevalent in high-income families. It is a genetic disease and is often passed from one generation to the next. Complications during fetal development and abnormalities in the brain, endocrine system, and immune system may all contribute to the development of this illness. The primary signs of anorexia are fear of being overweight, extreme dieting, an unusual perception of body image, and depression. The secondary signs and symptoms of anorexia are all related to the caloric and nutrient deficiencies of the unbalanced diet and excessive weight loss, a multitude of skin abnormalities, diarrhea, cavities and tooth loss, osteoporosis, and liver, kidney, and heart failure. There is no physical test that can be used to diagnose anorexia and distinguish it from other mental illnesses. Therefore, a correct diagnosis involves eliminating other illnesses, hormonal imbalances, and nervous system abnormalities. Treatment of any mental illness involves not only the individual, but also family, friends, and a psychiatric counselor. Treating anorexia often involves a registered dietitian who helps to provide dietary solutions that are adjusted over time. The goals of treatment for anorexia are to restore a healthy body weight and significantly reduce the weight obsession and behaviors associated with the eating disorder. Relapse to an unbalanced diet is high. Many people do recover from anorexia. However, most continue to have lower than normal body weight for the rest of their lives. Bulimia. Bulimia, like anorexia, is a psychiatric illness that can have severe health consequences. The NIMH reports that 0.5% of females and 0.1% of males will have bulimia at some point in their lifetime. Bulimia is characterized by episodes of eating large amounts of food, followed by purging, which is accomplished by vomiting and with the use of laxatives and diuretics. Unlike people with anorexia, those with bulimia often have a normal weight, making the disorder more difficult to detect and diagnose. Bulimia is characterized by signs similar to anorexia, such as fear of being overweight, extreme dieting, and bouts of excessive exercise. Secondary signs and symptoms include gastric reflux, severe erosion of tooth enamel, dehydration, electrolyte imbalances, lacerations in the mouth from vomiting, and peptic ulcers. Repeated damage to the esophagus puts people with bulimia at an increased risk for esophageal cancer. The disorder is also highly genetic, linked to depression and anxiety disorders, and most commonly occurs in adolescent girls and young women. Treatment often involves antidepressant medications and, like anorexia, has better results when both the family and the individual with the disorder participate in nutritional and psychiatric counseling. Binge eating disorders. Similar to those who experience anorexia and bulimia, people with binge eating disorders have lost control over their eating. Binge eating disorder was only recently classified as a distinct psychiatric illness, becoming formally recognized as a diagnosable eating disorder in 2013. People with binge eating disorder will periodically overeat to the extreme, but their loss of control over eating is not followed by fasting, purging, or compulsive exercise. As a result, people with this disorder are often overweight or obese, and their chronic disease risks are those linked to having an abnormally high body weight, such as hypertension, cardiovascular disease, and type 2 diabetes. Additionally, they often experience guilt, shame, and depression. Binge eating disorder is commonly associated with depression and anxiety disorders. According to the NIMH, binge eating disorder is more prevalent than anorexia and bulimia and affects almost 3% of individuals at some point during their lifetime. Treatment often involves antidepressant medication as well as nutritional and psychiatric counseling. Orthorexia. Orthorexia is a newer disordered eating behavior defined as an obsession with healthy eating. The term orthorexia was first defined in 1998, but it has yet to be formally classified as an eating disorder, making it difficult to determine how prevalent it is. Research suggests it may be identified as a form of obsessive-compulsive disorder. While focusing on a healthy diet isn't inherently a bad thing, in situation of orthorexia, an individual takes the emphasis of healthy eating or clean eating to the extreme, so much so that it becomes a fixation, putting their health at risk. Signs of orthorexia include compulsively reading food labels, cutting several food groups out of the diet, spending an unusual amount of time focusing on what foods may be available at upcoming events, and experiencing a high level of stress when healthy foods are not available. The obsession with healthfulness comes with a high social cost, as it is often difficult to enjoy eating out or sharing meals with friends and family. There is no formal treatment plan for orthorexia, but many eating disorder experts treat it similarly to anorexia and obsessive compulsive disorder. If you think you or someone close to you might have an eating disorder and you want to learn more or find resources,